I'm very honored to be invited to this conference. I have been participating in some of the speeches, and being an entrepreneur, I always look for inspiration. And I must admit that the most inspiring sessions are from the people with lived experiences. I will give you a short, brief presentation of Lake Hurdal Recovery Center and what we have achieved for the last 7 years. And I have a little subtitle, provocative, I hope, the prototype of the future psychiatric hospital question. The contents will be a little about our vision, the background of this hospital, how we are organized, the results we have had, challenges we have, and the method's strength. When it comes to the vision, and you have to organize a hospital for people in crisis, you have to think of what this means for yourself. What do I need when I'm in a crisis? What's the most important thing? Is to meet people that care for you, that understands you, and that treat you with dignity and respect. And this is often by human being associated with the heart. Of course, when we designed this hospital, it was clearly a given goal from the users organizations in Norway. But what me as an entrepreneur are thinking about is, I want to create a hospital that I could be a patient in myself. If you look at the background in Norway, since the mid-90s, we had a political goal in Norway to reduce the use of forced treatment within psychiatry. They changed laws and giving regulations, but still after, for the last 12 years since the major law changes in Norway, we still have a lot of forced treatment. To be exact, we have an increasing use of forced treatment during the COVID situation. And the patients' organizations in Norway, which are very strong, have worked for several years claiming the need of medication-free treatment programs as a necessity for reducing the use of forced treatment. Because if you don't believe in the medication, or you don't have any effect of your medication, you have to be treated with something else, or at least you could choose. And this was in 2010. They reached their goal when the Norwegian Parliament actually decided that medication-free treatment alternative should be a part of Norwegian psychiatry. So they managed. And the Ministry of Health, every year, they write a letter to the psychiatric field, the regions. This letter with 10 points every year said in 2010, you have to make and to create such an offer within the hospitals. Nothing happened in 2010. Nothing happened in 2011. Neither in 2012. In 2013, the users organization came to me and asked me to help them describe, after their input, how will our hospital look like. We used 3-4 months to do so, and the purpose with this description was to give the users organization something they could bring back to the Department of Health and tell, this is how we want it. A recovery-oriented hospital. But nothing happened the next year. And in 2015, I was given the opportunity, actually, to start Lake Hurdal Recovery Center. And that was 5 years after the parliamentary decision. A year later, we had another hospital offering the same, just the same treatment program in Tromsø, the very further north in Norway. If you look at the hospital, it's a private psychiatric hospital with a governmental approval and payment. Today we have 2 locations, 60 beds, and it's located 20 minutes north of the airport of Oslo, in a small municipality called Hurdal. And there is, of course, we have this approval like all other psychiatric hospitals in Norway, so there's nothing funny about that. And to run a psychiatric hospital, you have to follow a certain framework of laws. And when it comes to competence, there are the same rules for us as for everyone else. All patients have therefore their own psychiatrist or psychologist. Each stay is for at least 4 months, up to 6 months if needed. But when it comes to the treatment program, it's a group-based teaching focusing on psychoeducation. Okay? So we're talking about 3 pillars. The illness management and recovery program, 5 days a week. 5 days a week. Then, for the body, high-intensity training. 5 days a week. And I must admit that this high-intensity training outside is maybe the first and most important issue for the patient to really feel there is something happening positively with me. And at least healthy diet from our excellent chefs. In a surrounding which benefit recovery, place to recover, a place to meditate, a place to walk, to have beautiful nature, and of course, people with the right mindset in a very positive atmosphere. And briefly, at the findings from 7 years of employing recovery-oriented treatment, about 650 patients, 80% patient satisfaction. 80%. And 70% of our patients wants to reduce or stop using psychopharmaceuticals. And out of this group, we have found out that phasing out drugs is demanding for many and must be customized. And it's a very, very tough job for many. But 80% meet their personal goals of reducing or phasing out psychopharmaceuticals altogether. And that happens, as in this drawing by one of our patients, tanker and følelser, thoughts and feelings. When medication is out, thoughts and feelings come out. If you look at our challenges, of course, mainstream is powerful lobby, neglecting political decision, reforms, laws, and strategies. Almost impossible to recruit the first psychiatrist willing to work within this system 7 years ago. Today, the situation is completely different. Sabotage by mainstream, not letting patients choose their hospitals like they are supposed to have in Norway, making it economically very difficult the first years. And the first few patients we had was very difficult cases with decades of earlier hospital treatment behind them. Still, we managed to help them. But the saddest thing, I think, is that our excellent results and satisfied patients did not inspire our colleagues within the mainstream psychiatry. On the contrary, it provoked them. And the Parliament's decision, given the patient the right to choose, are still neglected in Norway by mainstream psychiatry after 7 years. If you look at the strength of the method, it is very easy implemented. And that's obvious because the patients setting their own goals are a game changer. This puts them in command of the treatment program, which is the basis for empowerment. And providing the patient with a treatment program they believe in themselves gives heavy motivation. Of course it does. If I believe it, I'm motivated. And the method is cost efficient because it increases the impact of all staff working together with the patient 24/7 toward the patient's goal. Not only the psychiatrist or the psychologist. Everyone knows your goal. And the cost of our hospital is 1/3 of the cost within the mainstream hospitals. And of course, at least half of our staff, of our professional staff, have lived experience. The only professional not admitting they have lived experience is the psychiatrist still, but it will come. I saw a guy from Poland today with a psychiatrist with lived experience. Very good. And staff with lived experience is indeed the key factor, giving the patient the necessary hope and motivation in their own recovery. And I'm sure that this is the main reason for our high success rate. We have today a waiting list for all kinds of professionals wanting to learn and work within recovery-oriented psychiatry. And that's completely different from 7 years ago. And in summary, it's quite easy, actually. We have to give the patients the treatment they ask for. And listening to the patient, giving him what he wants, gives motivated patients. And motivated patients are cost-efficient treatment. And it reduces the need of forced treatment. And I'm sure that the necessary changes this conference has been all about will be driven by satisfied patients in social medias. It will not be the mainstream psychiatry doing the change, it will be the satisfied patients telling the world, this is okay, this is not okay. This is the way we want it, this is not the way we want it. Thank you for your attention. We take the